March is National Kidney Month, and joining us now to talk much more about it is Dr. Cosette Jamieson, a medical director with Fresenius Kidney Care here in Maryland. Welcome, doctor. Great to have you here.
Thank you, Wyatt.
It's an important topic, and it's almost a frightening statistic. I mean, this is almost unbelievable. 1 in 3 Americans, 1 in 3, are at risk for kidney disease. Do I have that right?
That's right. And it's because kidney disease can manifest itself in patients who have long-standing hypertension and diabetes. And we have so many patients around with those problems. Patients who have cardiovascular disease, people who smoke, people who are obese are also at risk for developing kidney disease.
A lot of different risk factors, and one other sort of scary statistic or about kidney disease is often it presents very little in the way of symptoms. It's known as a silent killer.
That's true. Early on, kidney disease cannot necessarily be manifested in symptoms. Late kidney disease can find you with development of uncontrolled hypertension, swelling on the legs, starting to feel weak and tired and exhausted. So later on, 90% of the kidney function is lost when you're having those symptoms, unfortunately.
So we would obviously prefer to detect this as early as possible.
Absolutely.
Is one approach, I guess, at annual physical? Are there tests that we can ask for, things that will help detect this kind of thing early?
Yes, the blood work that the chemistry panel will tell you if you're having kidney disease. And of course, the urinalysis can also detect early signs like protein and blood in the urine, if that's present, and we know that we need to do more extensive testing to see if there's kidney disease.
When you think of the spectrum of patients, do a lot of the ones you end up seeing, doctor, they didn't ask for that at their annual physical? They didn't get it detected early enough? Is that a problem sometimes?
Well, sometimes we usually do blood work on the annual physical, but sometimes patients don't want to hear that they have kidney disease. They kind of want to deny it, and they may ignore that the first time they hear it, and then later on come back 2 or 3 years later, and it's gotten farther along. So we really encourage patients not to deny, and if you are told you have kidney disease, to get information and follow your numbers, the blood pressure and the diabetes, and make sure those are well controlled.
It makes a ton of sense. Now let's just say that someone out there, you know, gets that diagnosis. Okay, there are kidney problems. At Fresenius, you have a variety of options that people can have as treatment. Talk a little bit about the treatment options.
If you have end-stage kidney disease, then you can do dialysis. You can have dialysis in a center 3 times a week for 4 hours at a time. You can be taught to do dialysis at home. That gives you a lot more autonomy. And you can do dialysis that involves blood cleaning, as well as dialysis that involves a peritoneal fluid, that where you are having toxins exchanged and drained out of your body nightly. And you also do that at home.
People hear that word dialysis and they think, oh my goodness, this is going to be just so life-changing, such a burden. But it sounds like there are some things that are available now, where, as you said, the at-home option seems like that could be really an improvement for a lot of patients.
Yes, absolutely. And you know, at Fresenius Kidney Care, we want you to know that we're there to support you, not just to help you to do dialysis well, but to give you the psychosocial support you need and give you the hope that you will help you to thrive and live the best possible life you can. So there is dialysis, but there's also transplantation. And we have 195,000 people in Maryland who have been transplanted and are living with a kidney, of the 500,000 that we have on dialysis in the United States. And kidney transplantation is considered to be the best option for kidney failure.
Sure. So many options. Doctor, thank you so much for coming in and talking about this great topic and the hope for people that have ailing kidneys.
Yes.
Dr. Cosette Jamieson, thank you for being here.
Thanks for having me.
And we will be back with more Midday Maryland right after this. Stay tuned.